my name is John Myers and I'm a nursing student at South. I'm going to be doing the abdominal assessment on you today if that is okay.
Yep.
Alright, so I'm going to make sure you're in the right position. So you're in supine with your knees up, your hands behind your side, and a pillow under your head for comfort. Have you had any pain or tenderness in your abdomen recently?
Nope.
Alright, so I'm going to start off by inspecting your abdomen. So the color of your abdomen is slightly lighter than the skin on your arms and legs. Your abdomen the contour is flat. Your umbilicus is midline and inverted. You have fine villous hair around your umbilicus, and I do see a few moles on your abdomen. I do not see any lesions, hernias, pulsations, or peristalsis, and your abdomen does not seem to be distended. So I'm going to move on to auscultations. So I'm going to listen for bowel sounds starting in the right lower quadrant. Alright, so I was listening and I heard normal active bowel sounds, which have a high pitch and they have a cascading and gurgling sound, and they occur 5 to 30 times per minute. I was also listening for any hyperactive bowel sounds, which have a rushing and tinkling sound, and they're also high pitched and they occur more frequently. And I was also listening for hypoactive bowel sounds, which they're a little bit quieter and they occur more often. So I did hear bowel sounds, but if I didn't hear any, I would assess for an absence of bowel sounds, and I'll listen in the right lower quadrant for 5 minutes before I can determine if there was an absence of bowel sounds. So now I'm going to listen for arteries. So I'm going to switch to the Bellavance stethoscope. I'm going to listen for the aortic artery. And then for the renal artery, I'm going to use the patient's elbows as a guide to find them. Do the other side. And then for the iliac arteries, I'm going to use the iliac crest as a guide to find them. All right, and I did hear the arteries, but I did not hear any bruise, so that is a normal finding. So now I'm going to move on to percussions. So I'm going to percuss the abdomen and listen for the sounds that they make. All right, so I heard tympany, which is a normal finding for percussions on the abdomen. So now I'm going to move on to palpations. For the light palpations, I'm going to go about 1 centimeter deep, and I'm going to be assessing for surface character and the muscle tone. All right, so I did not feel, or the surface character was good, so I'm gonna move on to deep palpations. I will go about 5 to 8 centimeters deep and assess for any tenderness or masses in the abdomen. All right, and did you feel any pain or tenderness?
No.
All right, and I did not palpate any masses. So now I'm going to palpate for the liver and the spleen. So I'm going to get the patient, I'm going to hold the patient behind the ribs. I'm going to get you to take a deep breath and exhale. And one more time, and exhale. All right, and I did not palpate the liver. Did you feel any tenderness or pain? All right, so I'm going to do the same for the other side for the spleen. All right, inhale and exhale. One more time. All right, and I did not palpate the spleen either. Did you feel any tenderness or pain?
No.
All right, so for palpating the kidneys, I'm going to get you to sit up. And did you feel any pain or tenderness? Did you feel any pain?
Nope.
All right, so that completes my abdominal assessment, and I'm going to perform hand hygiene.